Welcome to Psychologist Talks. On today's episode, I just want to briefly talk about why chronic depression could be a sign that you actually have a personality-related issue rather than this more clinical, medicalized diagnosis that the current diagnostic manual and even medical providers tend to collude with. So when we talk about chronic depression, we're not talking about just a couple of months. We're not talking about a particularly bad year. We're talking about year over year over year with periods of remission. This is when symptoms are not present that don't last for more than maybe a few months at a time. I mean, this is not something that goes away. It is a passenger in somebody's vehicle. And unfortunately, these more medicalized, diagnostic labels, they don't provide a lot of information about why is this happening to me. Inadvertently, I don't think they intend to do this, but inadvertently, they collude with an underlying belief that something is foundationally wrong with me, which is just tragic. One, as you often hear if you were to watch more of my content, depression is not necessarily just a clinical symptom. It is a part of all of us. It is a part of the human condition. And for us to pathologize it is already audacious and dangerous enough. Never mind if we medicalize it and say there is something fundamentally wrong. It is an illness, it is a disease, rather than something inside of us, a part of us that has gone awry. Why is this so important? Well, our job is not to eradicate it if it is that chronic. Our job is to understand it, manage it, and live more fruitfully and intentionally with it. Now, what does that describe? Does it describe major depressive disorder? Does it describe dysthymia, now aka the mouthful known as persistent depressive disorder? No. What it actually describes is personality, something inside of us that is really complex. It's a mixture of nature and nurture. It's a mixture of biology and, to a certain degree, our experiences and adversities and traumas. And depressive personalities can arise over time, and part and parcel to that diagnosis is a chronic, unremitting nature of depressivity that even on our best days, our depressive selves are lurking right below the surface, right behind us, just waiting to grab onto any juicy red meat that reminds us how bad we are, how fruitless our endeavors will be, how hopeless the future might be. And if we don't treat it for what it is, we will likely remain stuck, because people who come in with these chronic conditions typically do not respond to therapy in short order, and they do not typically respond fully to medication. Are those things helpful? Yes. Are they incrementally helpful? Yes. Can medication provide a softening effect? Absolutely yes. But if we mislabel it, if we misunderstand it, if we treat it like an illness that we have somehow caught and that we cannot escape from, we are dooming people to a treatment that is unlikely to be helpful for them. And so I point you to my Depressive Personality Disorder episodes if you want to take a gander at those and dig deeper into this idea. But if you have been struggling with depression for year over year after year, and it's just not getting better, there's something that you cannot quite escape, perhaps you might want to consider personality has something to do with it. Now, I will note before I sign off of this episode, one of the other popular theories that seems to be floating around is that everything is related to trauma. Well, it could be. Trauma is highly correlated with the development of personality-related issues. But once again, I fear there is something incredibly short-sighted if we offload all of our mental health problems onto saying, well, it must be trauma. No. It is not that simple. As I said earlier on, more than likely, it is a mixture of nature and nurture. It is something inside of us that we do not have control over, as well as the life experiences that happen to us thereafter. And those life experiences do not have to be relegated to trauma. If we set the threshold for trauma and trauma alone, a lot of people will once again be left out with nowhere to place themselves. Well, I wouldn't consider my past traumatic, so why am I so chronically depressed? Well, personality doesn't require trauma to be conceptually accurate for you. So I hope this sparks a little bit of curiosity. Again, please, I will link below episodes related to depressive personality. And as always, thank you for listening and watching, and stay curious.